Lip lines and wrinkles around the mouth. Why do they seem to sneak up out of nowhere? And what can you do to help erase them or minimize their appearance? This is something that I tackle every day in my office. Whether they're the already etched in deep lines or whether they're just the beginning of the little wrinkles that form around your mouth, there's so many different in-office procedures that we can do to treat, correct, and prevent annoying lip lines so that you don't look and feel older than you actually are. In this video, we'll take a deep dive into why these lines form, how you can have normal life habits to help prevent their occurrence, and non-surgical procedures that we can use to help erase these lines. All right, my beauties, are you ready? Let's get into it. Okay, so let's talk about it. These little etched in lines that you can get around the mouth, or even the beginning form of them when they're just little wrinkles or fine little lines that over time can become really creased and really etched in over time. Why does this happen? And why does this happen to some people and not others? Well, first and foremost, everyone is different genetically, and we all have different skin types, different skin histology, different skin thicknesses, and different genetic backgrounds that can may predispose us to certain ailments that happen as we gain wisdom and have birthdays. I don't like to use the word aging because aging is a blessing, but as we gain wisdom and have birthdays, these different changes happen within the skin and the underlying structures of the skin that set us up genetically to have things like perioral rhytids, which we call in dermatology, or smoker's lines, aka Stanley cup lines. So basically what happens is the epidermis and the dermis thin as we gain wisdom and have birthdays. We lose collagen and we lose elastin. The fibroblast cells, which are the collagen producing cells in the skin, stop making as much collagen as they used to. So we don't have that structural support. We don't have that support system in the dermis, in the papillary and reticular dermis, which are the deeper structures of the skin. So when we move our mouth, and there's a muscle called the orbicularis oris muscle that goes around the mouth here, and as that, it's a sphincter-like muscle. In medicine, a sphincter is any circular muscle like this. So hopefully you guys don't have any bad things to say, but it's a circular muscle that when it contracts, like in the esophagus or the GI tract, it has a concentric kind of contraction. And when you're contracting that orbicularis oris muscle around the mouth, the skin that is overlaying that muscle kind of gets accordion like squished. And so over time, when you're doing this movement, you'll start to get those little lines there. And over time, they become etched in. So things that we can do to help minimize the movement of that muscle, you still want to be able to talk and eat and whistle and spit out your toothpaste and live your life. But for example, if you're drinking through a straw or a Stanley cup, you might want to drink through the straw on the side of the mouth. And believe me, you can do it. I've gotten really, really good at this. I started at age 22 drinking through a straw because I also want my teeth to remain white. So I don't want to drink, my coffee or my tea without a straw. But when you put the straw in the corner of your mouth, it actually kind of helps with minimizing the contraction of the orbicularis oris muscle around the mouth to help decrease the skin folding on itself. I always tell my patients this. Skin is like cardboard. The more that you fold it over time, the more etched in it gets. So even if you lay cardboard flat, it's still going to have that little etched in line. But if you can kind of habitually train your mouth and your muscles to move in a different way, it can help dramatically decrease the incidence of those etched in lines. And you can always look at your parents and your grandparents, and if you're like, ooh, mom's starting to get these etched in lines and grandma really has these etched in lines, so I know I'm genetically set up to have that, so I'm going to do things in my life to help prevent that. It kind of gives you a little flash forward preventative insight to where you're headed genetically. Sometimes people will have under eye bags, or sometimes people will be more genetically predisposed to jowling. Some people are more genetically predisposed to lip lines. So doing habitual things in your life that you can do, like drinking through a straw from the side of your mouth and not contracting that muscle as much, will help over years and decades of life to help prevent those lines. Now, sometimes my beauties and my patients in the office will get little perioral Botox. So we do like 1 unit, 1 unit, 1 unit, 1 unit, a very small amount of Botox to where you can still animate, you can drink, you can talk, you can live your life and use your mouth, but it inhibits your orbicularis oris muscle from contracting really, really firmly to make those lines. And I remember when I was, my early 20s, I was in an aesthetics lecture. Of course, I've been obsessed with aesthetics since I was a first-year medical student. And I remember learning about this technique, and I started doing Botox around my mouth when I was like in my early 20s. And now at 47, I still do Botox every once in a while, but I don't have to do it as much because I've almost trained myself not to make that muscular contraction to where I'm going to make the lip lines. Now, for people who already have lip lines or want to be more preventative with a more aggressive approach in office, other things that we can do are things like filler, lasers, you can have ablative or non-ablative lasers. You could do microcoring through Ellacor technology. You can do TCA peels, glycolic acid peels, various depths, medium and superficial depth peels to kind of help soften those lines. But it's always important to know that once that muscle is still moving, even if you do a treatment to help resurface the smoker's lines, or I'm gonna call them smoker's lines for the rest of this video, but they're basically lip lines. If you do a laser to help smooth that out, and then you just start moving your muscle and start scrunching that skin on top of itself again, you're gonna get it again. So I had an attending once that said, perfect, if you wanna do CO2 laser and erase the lines, unless you just stay like this for the rest of your life, those lines are gonna come back. So usually a little neuromodulator to help train the muscles to not contract as hard to cause those lines. And it's really important to go to an injector who's highly trained, because a lot of people will over-treat this area because it's a sweet spot. You want just enough to help soften that muscle, but not enough to where you can't spit out your toothpaste or kiss or do anything fun. So it's just really important to just make sure that you're not over treating that area and you're doing just enough for an aesthetic outcome, but you're not impacting your quality of life. And you can still eat and talk and chew and spit and do all the things that you usually do on a normal basis. So another thing that happens as we gain wisdom and have birthdays is that the structural support under our skin also changes. Our fat pads become atrophic or thinner. Our bone gets resorbed. So the bony structures of our chin and our jawbone and our maxilla, it gets thinner over time, and so you don't have that structural support holding up the skin. So your thin skin sitting on top of these structures are just more predisposed to getting etched in fine lines and wrinkles, and around the mouth they could be most prominent. And around the mouth wrinkles will age us faster than any other wrinkles in any other area of the face for whatever reason. When the eyes scan the face and the brain perceives certain images, when the brain perceives perioral lines, even if you're in your 20s, it will make you appear older, and they've done studies to show that. So it's really important to tackle them once they happen. Again, you can use a little bit of Botox to soften it, and if it's already apparent, then we can use laser resurfacing to kind of smooth in those lines. Or for people who are not afraid of filler, and if you go to an astute injector who knows what he or she is doing, a very small amount of filler can be used to fill in those lines without giving that over volumized Marge Simpson duck lip look. And it's taken me 20 years of being an injector to really get this down, and I feel that it's a skill set that I've had that I've worked my entire career on to be able to erase those lines without over volumizing the lips. Because yes, you can make anyone have their lip lines go away by pumping a bunch of filler in their mouth, but you don't want them looking like Ducky or like Marge Simpson, or looking weird on a profile or oblique view when the lip has that certain done look. And we see it all the time here in Orange County, but that's because a lot of providers are doing way too much filler, not injecting it correctly, using the wrong type of product, and just aren't very highly trained. So you can erase those etched in lines with filler without looking over volumized if you go to the right injector. So sometimes it's doing a little neuromodulator, sometimes it's doing little droplets of filler. Now there's a new kid on the block, which is a new hyaluronic acid-based injectable. It's called Skinvive. Skinvive was originally FDA approved for hydration of the skin to help smooth texture in the cheeks, but it's being used a lot off-label on the neck and also in perioral rhytids. The injection technique is a little bit different. It's a very low G prime, very thin superficial filler. We don't even like to call it a filler. It's a texture smoothing injectable, but the way you inject it is by little droplets, and if you do it along a lip line, it allows smoothing of the lip line without adding that extra volume. Volbella is another really low G prime superficially injected filler that I love for erasing perioral rhytids or lip lines as well. So we talked about Botox, we've talked about fillers, we've talked about laser resurfacing. Now when you talk about lasers, you can do ablative or non-ablative lasers. Non-ablative lasers just basically heat up the skin and induce changes with collagen stimulation and rejuvenation of the skin through dissipation of heat. Ablative lasers like a CO2 or an erbium may be a little bit more aggressive, a little bit more downtime, but the results are a little bit more noticeable, if you will, especially for around the mouth, like lip lines. It's usually under eyes and around the mouth. You want sometimes a little bit stronger treatment, and usually that is with a non-ablative laser. And CO2, I have a CO2 core in my office. It is a magic wand for helping erase perioral rhytids or lip lines and under eye fine lines and wrinkles. And usually it's about 3 treatments, anywhere from 1 to 3 treatments spaced 1 month apart. Usually people have 1 treatment and they're stoked with their results, so we don't take it further. But people who happy with their results and want another treatment and want a little bit more, beauty's in the eye of the beholder. So I never do packages in my office. I'll usually say anywhere from 1 to 3 treatments. We stop when you're happy. And so a CO2 core is one of my favorite lasers for perioral rhytids or lip lines. So we've talked about lasers, we've talked about dermal fillers, we've talked about neuromodulators, and last but not least, I want to talk about Ellacor, the microcoring technology. Ellacor takes little punch biopsies out of the skin. It's basically like shrink wrapping the skin by skin excision, and it's FDA approved for the treatment of moderate to severe rhytids and lower face jowling and wrinkles and rhytids, but we use it off-label for perioral lines, and it gets great results. Sometimes there could be a little demarcation of where the treatment actually occurred. So because of that, sometimes with certain patients, I'll recommend a CO2 resurfacing instead of microcoring, but microcoring is a whiz. I remember using it during clinical trials for lip lines, and we were astounded with the results. Oftentimes you'll need more than 1 treatment, so it's always important to know that 2 to 3 treatments may be needed. Again, beauty is in the eye of the beholder. You'll get an improvement with each treatment, but say you're removing 10% of the skin with each treatment. If you do 3 treatments, you're removing 30% instead of 10% of the skin, which will yield better results. So just note that the downside of Ellacor is there is downtime of about 1 week, and there could be a little bit of demarcation left on the lip line area that was treated. If there is demarcation, we can usually erase it with a resurfacing laser a couple weeks after the treatment without a problem. Last but not least, I want to talk about peels. So we can do a peel, either a light superficial or a mid-depth peel. And sometimes when you combine it with a laser, it's like a 1 + 1 = 3 synergistic result and effect. So sometimes we'll do a light chemical peel and then laser on top if the etched in lines are really, really severe. But again, just make sure that you're going to an astute clinician who does this. I would avoid plastic surgeons sometimes because they just rent these lasers. They don't do lasers day in and day out like dermatologists do, and sometimes they're not as well versed with the machine. And then on top of that, you're under general anesthesia. So if they're doing a peel and they're doing a laser and you're not awake, alert, and oriented enough to say, hey, that's hurting, or hey, that's too much. I've seen a lot of complications, unfortunately, from plastic surgeons, and they all refer to me to fix it when things go wrong in the OR, when they're renting some laser 1 day a month and they do a peel on their patient who's totally out under general anesthesia and can't fend for themselves. And it's something that I see far too often, so I wanted to mention that in this video. In a dermatologist's office, usually we'll do a light peel and then we do a laser on top, and we take it very slow but very progressively and get you to your end results safely and effectively while minimizing complications, which is extremely important, especially in my darker skin type beauties who are more prone to hyperpigmentation or even worse, depigmentation. It's very hard to correct, and we've seen a lot of complications on the outside from other offices. So just be careful with who you're going to, as always with anything. And one more treatment, threads. So smooth threads, not like the PDO threads that we use for like thread lifts in the face for jowling or neck rejuvenation, but smooth threads that are collagen producing and collagen banking threads. Usually we could do the smooth threads in those areas. We've seen great results with that too. Usually as a standalone treatment, it's not enough. I'm more aggressive as a cosmetic dermatologist, so I'll usually combine it with a laser or with a peel or with a little dermal filler if needed. But smooth threads, for those of you, I know you're gonna probably ask me, could be an option as well for perioral rhytids. And there's another entity called Easy Gel, which is like a biostimulatory filler that gets mixed with your own blood plasma. Historically, PRP and PRF, the problem with those entities are that they don't last as long, but there's new technology with biostimulatory effects that provides a scaffolding to allow those products to last longer. We're gonna demo them in my office. I've had mixed reviews and results with the results so far, so I don't want to recommend anything to you guys. Again, I'm not sponsored. I don't wanna recommend anything to you guys that I haven't seen with my own 2 eyes with amazing before and afters and reproducible results and happy patients. So I'll let you know what the verdict is on Easy Gel as well. So as far as perioral rhytids and lip lines, those are pretty much the mainstays of therapy, habitual things that you can do in your lifestyle, especially being careful drinking through a straw, drink from the side, and just, keep up with preventative measures. If you're younger and you're genetically set up for getting these lines, you see it in your parents, make sure you do a little bit of Botox, and then just make sure that you're using photo protection, sunscreen, and active ingredients in your skincare products to help minimize the appearance of lip lines as well. All right, you guys, love you and see you next week.